Hello everyone, I am Dr. Anushiravan and I have been involved in dental implant assessment and planning over the past 22 years with a particular expertise in treatment and maintenance of dental implants here in London. Many people have heard about dental implants, however, it appears that most people do not seem to know the detail of what is involved in this very popular and successful dental treatment. If you are currently missing one or more teeth, dentistry offers many options that will restore the gaps, your bite and your smile. Anytime you have a tooth removed, the surrounding teeth can shift and tilt towards the gap over time, changing your bite and the appearance of your smile. Dentists can't predict when and to what extent these movements will happen. In some cases, there won't be any changes, and in other cases, excessive shifts can occur, partially closing the gaps, making it difficult to fill in the future. There are generally three options to resolve this: implants, partial dentures, and bridges. But in this video, I'm going to be covering implants. Dental implants have become increasingly advanced and popular in recent years. The first component of a dental implant is a titanium screw that can be placed into the missing tooth space to replace the root of the tooth. Experience demonstrates that this procedure takes approximately 1 to 2 hours. It's totally painless and that patients only feel a minor discomfort the day after the procedure. This is followed by a 3 months healing period or 6 months in more complex cases, such as those requiring bone grafting. During this 3 to 6 months period, temporary teeth can be placed to fill the gap. This healing period allows the implant to biologically connect with the surrounding bone. This is an implant-bone integration that allows the implants to survive in the mouth for many years. At this appointment, a second component called an abutment will be placed onto the implant screw, and an impression of the implant and surrounding area or a digital scan will be sent to a dental implant technician for the fabrication of the implant abutment and the crown. 2 to 4 weeks later, the abutment and the crown would be inserted to finish the implant placement. This can all be summarized into 3 steps: the placement of the implant screw, the impression or digital scan after 3 to 6 months, and finally the placement of the abutment and the crown after 2 to 4 weeks. In rare circumstances, all these steps can be carried out in one single session rather than waiting 3 to 6 months. However, this needs careful assessment and planning in addition to the experience of the clinician, and is very case dependent. Dental implants have been around for over 50 years and are a safe and well-established treatment with many advantages over dentures and bridges. Because a dental implant can be placed in the missing tooth space without being attached to the adjacent teeth, like a bridge, it is an independent unit acting like a natural tooth. The adjacent teeth are left untouched and do not need reshaping or remodeling. This allows you to clean around implant-supported crowns very effectively using interdental brushes compared to bridges, which tend to obscure the interdental spaces, making them very difficult to clean. A common question is, can everyone receive dental implants? The answer is normally yes, as long as you have no major health conditions or illnesses such as the ones listed on the screen. If these don't apply to you and you are over the age 23 for males and 25 for female patients, you can generally speaking undergo dental implant treatment. Your dental and general medical health will be assessed by your dentist, who will also be looking at factors like sufficient bone volume and space in your jaw for dental implants. When natural teeth are removed, the bone around these teeth will shrink. Often, up to 50% of the bone volume is lost in as little as 3 months. Inadequate amount of bone in the missing tooth space can make the dental implant treatment more challenging. However, your dentist can usually perform a bone grafting procedure to facilitate the placement of a dental implant. An experienced dentist will easily be able to evaluate bone volume with the help of 3D scans. There are a few different bone grafting procedures, and your dentist can give you detailed information once the 3D scan is assessed. This is a painless treatment and often can be done over a short 90-minute appointment in the dental chair. If you are planning to straighten your teeth with the help of braces or clear aligners such as Invisalign, it is better to defer your implant treatment until after your orthodontic treatment is completed. This can be planned well in advance with the help of your dentist. You should also understand that implants may not always work, as they may fail to integrate with the bone. This can happen as early as 3 months after the implant placement, or some years later. There are a variety of reasons behind implant failure, such as an uncontrolled diabetes, previously advanced gum disease, tobacco smoking, lack of adequate oral hygiene, and lack of compliance with prescribed implant care instructions. The same way that your teeth are susceptible to gum disease, implants are also susceptible to peri-implant disease, such as peri-implant mucositis and peri-implantitis, which are professional names for gum disease of the implants. However, evidence in literature shows over 90% survival rates for dental implants, making them a viable and successful treatment option. Implants have evolved significantly in the past few years, and they are made with materials and designs that give them a longer lifespan, provided the conditions in the mouth are optimal. The process of having a dental implant treatment is very personalized, and the steps I spoke about may vary based on the individual parameters for each patient. You need to make sure that your experienced dentist thoroughly assesses your mouth based on study models, radiographs, photos, and if needed, 3D scans before a comprehensive treatment plan is offered. This treatment plan must include the dentist findings, a summary of your discussions and your wishes, the number of procedures, timings, a full financial breakdown of the costs, in addition to the risk factors for implant failure and care instructions for your implants. You should read your treatment plan carefully and ask all your questions before deciding on having dental implant treatments. I want to thank you for your time and attention, and please feel free to contact me at White Rose Dental Studio London if you have any dental implant related questions, and I will be more than happy to help. Thank you for watching.